Hi guys, Tony Maritato here, physical therapist, and in this video I want to share some stories from the clinic. So this morning I had the great fortune of working with a new patient. I had never seen this person before, and I want to share the story. Obviously I'm going to change details so that I protect the patient's privacy. He might be she, John might be Jane, but the goal is for you to learn from other people's experiences and to share the information that we have available. So this morning I had a young male patient who arrived at the clinic with some shoulder pain. Now the pain had started approximately a year ago. Came on out of nowhere, woke up one day and just had pain. And so this individual had no complexities or comorbidities. They weren't diabetic, they weren't hypertensive. They were living a normal life, doing normal daily activities, and just had pain. So immediately when I hear a story like that, I start to rule out certain things and I start to think about other things. And as the story evolved, this individual had said that he was seeking some medical advice, went to an orthopedic surgeon. The surgeon did some imaging, suggested that there was no real apparent tear, no real apparent problem in the shoulder. They tried cortisone injections. There was no pain relief. The cortisone injection was applied from the back of the shoulder forward. The person tried physical therapy, not at my clinic, but at another clinic. And after 2 or 3 sessions, just felt like it wasn't getting better and felt like, if anything, the exercises might be making it worse. So from there, they just said, I'm stopping everything. And for several months, they did no new exercises, no new stretches. They didn't try any other medication. They didn't do anything, and just wanted to give it time to see if it was going to get better, which in many cases is a reasonable approach, especially if you've seen an orthopedic physician who can rule out any major red flags, any major problems. So after several months, no significant improvement, this individual decided to go back to a different doctor for a second opinion. The second doctor gave them a second cortisone injection, this time in the front of the shoulder, and the patient experienced significant reduction in pain, but believes that because of the almost a year of not really using, now it is the dominant side, not really using the arm and the shoulder, now they're weak and now they have limited range of motion. So the patient was referred to my clinic for physical therapy, and I want to give you an idea of the physical therapy evaluation and kind of the programming and what we think is going on. So this morning during the initial evaluation, the pain report was very low. No pain at rest, a little bit of pain with activity, and that's about what I was told. Then when I asked to see the range of motion, the patient was able to reach full shoulder flexion, which is reaching overhead. They were able to touch the base of their neck. But when they went to reach behind the body to put their hand on their low back, that's when the pain kicked in. And the pain was localized to the front of the shoulder. So immediately as a physical therapist, I'm thinking biceps tendinitis, biceps tendinopathy. And so one of the questions I asked was, I asked my patient to reach his hand out in front, full elbow extension, and we did a little bit of resisted testing again that produced positive pain response. There's something called a speeds test, which could be suggesting that there's inflammation or at least acute pain at the long head of the biceps tendon. So what we're going to do in this case is we're going to look at creating a biceps tendinopathy protocol, trying to reduce some of the pain, desensitize the tissue in the front of the shoulder, trying to build some strength back into the shoulder, some stability in the shoulder. If she feels that it's unstable, we want to do things that improve the nervous system, the muscular strength. She has the range of motion already, so we're not going to be doing a lot of stretching. And essentially a program initially for somebody like this is something that looks like about 10 to 15 minutes of warming up the tissue. Various exercises that are well below the maximum strength threshold, that are just repetitive in nature. We would consider them cardiovascular exercises to improve blood flow, maybe acutely change the chemical environment, right? Very often patients will tell me, well, if I go to move the first time, it hurts. If I start doing repetitive action, it feels better as it warms up. But then if I keep going, it starts to hurt again. Okay, that fits a very classic model. And so what we want to do is we want to change the chemical environment locally. We want to get all the good proteins and hormones into the area. We want to flush out all of the waste products. And if we can do this repeatedly throughout the day, we have the best chance of creating an environment for healing. So we were talking about 10 to 15 minutes of repetitive, low intensity exercises to change the chemistry and get the blood flowing through the area. We talked about a couple self-massage strategies to the musculature and the supporting structures around the painful site. So using a tennis ball to massage the upper trap, to massage the pec, to massage the bicep and the posterior shoulder. That's going to take about another 4 to 5 minutes, just kind of working through all of those areas. We talked about a little bit of strengthening, whether it be isometric, eccentric, concentric, strengthening the shoulder and the shoulder girdle so that we include the muscles that support the scapula, we include the postural muscles, the neck muscles. And then we talked about just figuring out what are the 2 or 3 easiest things to keep doing throughout the day repeatedly to influence the best chance of tissue healing. You know, now on our next session, we're going to dive deeper into quality of sleep. We know sleep quality is super important for tissue healing. Sleep quality is super important for pain sensitivity. We're going to talk about quality of food and nutrition because our bodies can't heal if we don't have the raw materials available to rebuild the collagen, to lay down new fibers and allow the body to heal. And then we're going to talk about some of the other lifestyle stuff that's going on. You know, are there things that are going on that are restricting her body's ability to heal the tissue? When I hear somebody has been dealing with a persistent problem that's going on more than a couple days, more than a couple weeks, in this case almost a year, I'm looking at factors outside of the immediate pain source. Right? I'm looking for things like stress and stress management. I'm looking for meditation and mindfulness. I'm looking at nutrition and sleep. I'm looking at daily activities. I want to create the best possible environment. It's like planting a seed. I want to plant the seed in a garden that's ready for seeds. I don't want to just throw a bunch of seeds on the pavement and hope that something sprouts. So these are the factors that you should be going through with your physical therapist so that you have the best chances of healing the tissue. I don't look at this kind of condition as a true injury. To me, an acute injury is something that happens now that damages tissue, and we want to treat that kind of differently than when we treat a persistent problem like this, something that's not healing, that's not getting better with rest and ice and all your normal interventions. So guys, if these kinds of stories are helpful, if you find that you relate to the story, let me know in the comments below. I hope to share more case history and stories like this because I think that you sitting at home can learn a lot from what other people are experiencing. I'll catch you guys on the next video.